Thanks everybody for joining us today. We're going to talk about assessing your options, key decision points to optimize your revenue cycle operations. You know, every lab makes this decision. How are we going to bill for our services? What do we know to ask? What don't we know to ask? And our entire discussion today is really intended to shine a light on this process for you, to help you better understand your options that exist, along with those kinds of questions that you really need to be asking. Thanks, Carrie. It's my pleasure to introduce everybody to Robin's wife, Jeanette Gray. Robin is the Director of Coding and Billing Compliance for BioReference Health and is also Editor-in-Chief for the APF Pathology Services Coding Handbook. Jeanette is the Director of RCM for ProPath, a Sonic Healthcare USA practice, and Jeanette is also co-editor for the APF Pathology Services Coding Handbook.
When it comes to any worthwhile endeavor, it's very essential to have a clear set of guidelines and principles in place to help navigate the decision-making process. The nature of pathology billing is complex, so it's going to be critical to have a solution that is designed to address those unique challenges. Relying on a practice management or hospital billing system simply won't suffice, as they lack the functionality required to efficiently handle pathology coding, claim submissions, collections, and client billing. Instead, pathology practices require a comprehensive pathology-specific software that can streamline the entire revenue workflow, whether it's implemented in-house or through an outsourced model. This type of system is essential to ensuring that every dollar owed is collected. As pathology is complex, it can easily lead to lost revenue if not properly managed. The right tools and technology not only make the billing and collections process more efficient, but also provides valuable data and analytics that empower practice leaders to make informed, proactive decisions. Real-time access to key performance indicators is crucial for identifying trends, optimizing workflows, and ultimately boosting the bottom line. When it comes to the business side of running a successful pathology practice, having the right system and processes in place is key. An investment in a pathology-specific revenue cycle management solution can pay dividends by streamlining operations, maximizing reimbursements, and giving practices the visibility and control they need to thrive.
This all starts too with establishing a strong foundation that you can build upon for long-term resiliency and durability. There's 4 key areas of this foundation that I'd like to talk about. You can call these pillars for success, but I want to focus on tools, commitment, re-engineering, and implementation. Like any job that you take on, having the right tools is going to make that job easier. It's going to help you drive quality outcomes. It's also going to provide, the right tool is going to provide options for automation, which then lends itself to efficiency, consistency, minimizing your resource costs. It's also important that your leadership really gives you top-down commitment, that you have to be committed to what you're taking on here. You expect commitment from your vendor to keep their product at its cutting edge, and you expect your leadership to be committed to the course of action that's chosen. But then those two things come together with your mutual commitment to the business goals. It's also very critical to keep re-engineering on your dashboard as you embrace change. This is something that really should be continually thought about, because reimbursement challenges in the industry can sometimes just come at light speed. Your willingness, your ability to be proactive or quickly reactive keeps you challenging that status quo. It keeps you always striving to do better. I think it's important to keep in mind that you should keep it measurable and you should keep it manageable. The last item on here really is talking about the implementation. It's important that you are marrying the best solution with your strong SOPs that you want to have. That way you can gain the best of both worlds from each of those things. But when it comes to the implementation, there's some things to really keep in mind here. A successful implementation is one in which there's going to be a methodology in place that mitigates a cash dip at go live. Transitions, they're scary enough, right? And there's so much on the line, and it's paramount that your vendor has a risk mitigation plan. So when you take these four fundamentals and keep those in perspective, the next question really is, well, what's next?
So there's a couple of options we can look at. Let's look at option number one, outsource billing. I'm choosing to outsource your revenue cycle to a billing service. This is a great option for all different sizes of pathology groups. If you're struggling with obtaining talent or simply don't want to manage those day-to-day operations of billing. With this option, there are several key advantages. You leverage the vendor's expertise across all areas, from implementation and setup of the software to staff who understand how to get you paid, ultimately driving collections for your group. But you still get to retain that control of your client relationships. You still have a resource available at your practice to work directly with your outsourced billing vendor to handle items that need additional attention, increasing the chances of getting paid. And you have full access to your data. The timeline to begin billing with this type of model is typically shorter than an in-house model, 45 to 60 days. This allows for time to complete enrollments, integration to be completed, and for your system to be configured specifically for your practice. What groups really like about this option is it can be a transitional option. In other words, you let the company like Telcor manage your billing until you're at a point where you're ready to bring it in-house and do it yourself.
So that was option one. What about option two? This is really where you're taking on managing your billing operations yourself. A lot of key considerations here. One thing to know is you are in full control of this type of model. That includes everything from system administration, change control, all your relationships like Carrie mentioned. You're responsible for your staffing. You need tools to monitor and measure that team's productivity so you can keep your staffing right-sized and aligned with the processes you have in place. Also, depending on your volume and your complexity, your staffing numbers could vary, right? But regardless, you're still going to leverage automation to keep your resource costs aligned appropriately. You really want the system to be doing the heavy lifting for you here. With a pathology billing solution, your team will get to focus on areas that really require more human intervention, those harder to collect dollars. You know, speaking of money, there's always a sentiment too that's out there that there is nobody that's going to go after your money that's on the table more than you and your team will. From a technical vantage, you can minimize your IT overhead utilizing a software as a service model. That gives you that peace of mind that your vendor is responsible for everything from the hardware to the security, disaster recovery, sizing, maintenance, all those things that go into maintenance of that environment. When you look at this kind of model too, it's important to also really understand the timeline associated to it. You know, with an outsource model like Carrie mentioned, the ramp-up time can be quicker. This type of model is going to take a little bit longer. On average, what we see is about a 3 to 4 month implementation timeline. Sometimes those go quicker, sometimes those go a little bit slower, just depending on resources, technical hurdles, all the things that can go into a transition. Lastly, a few other key considerations that really are top of mind when you're evaluating any RCM vendor, right? I think it's really important that you see a demonstration of what you're going to get. You need to confirm some really key things here. Is there a return on investment for you? What are your costs? What's your contractual terms? What's support like? You need to check references too. This is really vital. You should check references regarding everything about that vendor, from the software to the implementation, what's ongoing support like, what's the product direction, do they have conferences they attend, do they provide their own conference, what sort of networking comes with the relationship that you end up having with that vendor.
And now we'll be turning this part of the discussion over to Robin and Jeanette to have insight from a provider on this.
Great, thank you, Carrie and Kurt. Really appreciate your insight and your time and sponsoring this webinar. Robin and I come from two unique perspectives. Robin, her company actually outsources their RCM services. And my direct company, ProPath, we have an in-house. We are now part of Sonic Healthcare USA, who also outsources. So we've actually been in the process of interviewing vendors and looking at that. So this is really timely for me. And so hopefully we can bring something to the table for everybody on the call. So first we're going to talk about in-house billing and talk about the pros and cons of actually both in-house and outsource. So as far as in-house billing, the pros of it are, and a lot of this is things that Kurt and Carrie already mentioned, that you can retain control. So I have complete control over my billing software. I have direct oversight on everything. I can make a change immediately. I don't have to rely on sending it to somebody, a vendor, opening a ticket, making a phone call, or sending an email in order to make that happen. I can make it happen almost immediately. Again, immediate accessibility to the detail, able to access all my data, all my information, helps me to answer questions immediately. If I get higher up management questions about how something's going or what does this division look like, blah, 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 all that kind of stuff. And the other is the potential for a higher ROI. So if we're already invested in our staff to train them and have put in that effort, we're going to get a better return on investment compared to switching to an outsourced model. So those are pretty much the pros. Robin, do you agree with that?
So I think to some extent, as you know, our organization had already made the determination to outsource before I joined. So the decision making was really not for me. But I think one of the questions that I would ask is, in today's environment where so many of our employees are remote from the office, the perception around the immediate feedback, is there really a true distinction between remote staff and working with a vendor who you also have to make that outreach to, right? You can't walk up to the desk and have that immediate face-to-face conversation. So I think, it's just a matter of level setting what the expectations are, and what are your today processes versus what you're expecting to receive from a potential to outsource.
Yeah, I do agree with that. And I will say, our practice, we are all remote. And we use chat options and other things, to communicate, pretty much timely.
Right.
But those definitely are issues, to consider. So as far as the cons of in-house billing, you will have higher operational costs. Obviously, you have salaries, you have benefits, you have the training, you're purchasing the software, and ongoing overhead and support, versus outsourcing it. The other staffing challenges, I mean, people call in sick, even though we're remote, it's better, but people still call in sick, or they need to flex their hours for whatever reason today, but you have a big project or something. So you're always going to have those issues, as well as turnover and covering when somebody's out on vacation or sick or PTO. So you have all of those challenges. Not to mention a low performing, staff person versus somebody that's performing at a higher level, but they're doing the same job. So those kind of issues. And then limited expertise. So you're training your staff, you're educating them with webinars such as this, sending them to conferences, possibly you're doing the training, things like that. But sometimes the outsourced vendor has more capacity and more places that they can go to get that information. Robin, what's your take on the cons?
Again, I would agree with you on the cons. There are challenges that we all face with the daily operations. One aspect is, who is responsible for educating your staff internally and making certain that everyone is remaining current to payer policies, regulation changes, and making certain that all that information is shared equally and that there's a level that is expected of understanding and ability to act and to comprehend all of that information. So, education of your in-house staff is really a full-time job. So you have to worry about how you're staffing that position, as well as managing your billing processes. So it's all something to be considered, but good pros and cons, I think, overall.
Yeah, and just to add a little bit to that too, even though it's a con of in-house billing, even when you outsource, you yourself has to maintain that information. You still have to stay up to date on what's going on in the industry and all the latest coding and billing regulations and things like that. So it doesn't just stop. So let's move on to outsourced.
All right. So, Jeanette, do you want to start off there with some of what you've looked at internally and considered for outsourcing, and then I can follow up with what our personal experiences have been as well.
Yeah, absolutely. So one of the biggest pros of outsourcing it obviously is the cost savings. All the salaries and benefits that you're paying your staff, that goes away. So definitely labor costs is a cost saving. And don't base it just on that. And that's the reason to outsource. That is not just the reason to outsource. So you have to look at all of these other, everything to make that decision. The other, as we were just talking about, is expertise. So many of the outsourced billing vendors, and you need to make sure you're asking those questions, have the expertise in pathology billing. And you need to know how they have that expertise, how long have they been in business and all that sort of thing. But as long as they, that's their primary business, you have to trust that they have that expertise and are keeping up with the industry regulations and everything else. The other is increased efficiency. So again, they have the advanced technologies and all of the streamlined processes at their fingertips. And those are things that will help you, your claims get faster to the payer, reduce your payment cycles, and hopefully improve your cash flow. And these are all things that, is not an additional cost to you. So that's a plus. And that kind of also goes with the access to technology. Again, they have access to the latest billing software. There's a ton of companies out there that do all these add-on things. We can do prior auth for you. We can do coverage discovery. They have all these different things they want to add on to your software. And if you're in-house, those are things you got to buy separately. But if you're outsourced, they have it all as part of it, and that's no additional cost to you. So they should have that readily available, not only for your business that you're looking at for them, but all of their other clients that they have using their service.
So if you don't mind, I'm going to step in and touch on each one of those, I think, for a moment, just real quick. But some of these decisions are also going to be driven by budget constraints, or, what is your organization able to negotiate as far as contract terms, and what is the cost of that contract. Certainly there's a cost savings because you now have reduced your salaries and benefits that are, the cost of having your in-house staff. You offset that though with your contract terms. What are you going to pay to that vendor to manage those processes for you now? So there is that offset to consider. And again, as I mentioned, what does your budget allow for? How much of that revenue cycle or billing cycle are you going to outsource? And how much are you going to maintain in-house? So I think that is, the sort of the pros and the cons all wrapped into one. You have to look at what does your budget allow for. Certainly expertise and compliance, you want to make certain that you have fully vetted that vendor that is going to be managing your revenue and your billing. Compliance within this industry is of utmost importance, and making certain that they do understand compliance as it applies to laboratory and pathology billing is very important. And remembering that we don't get to just hand off and assume that the vendor has that expertise and responsibility and that they're maintaining compliance. We do have the responsibility of due diligence and making certain that they meet our standards. Increased efficiency, I cannot disagree with that. I have found that outsource, the efficiencies and what it allows for us to do in other aspects of what we're managing in-house, I do agree there very strongly. And the access to technology. Certainly the technology that the vendor brings to the table is beyond what we would have been able to touch point with, other than having to be out and doing a lot of research and managing a lot of different vendors. It's nice to have a central source to go to and have those conversations.
Yeah, I completely agree with that. And I'm glad that you are experiencing some of those pros, especially the increased efficiency and cost savings within your practice. As far as some of the cons, of outsource, again, loss of control. And I know a lot of people that have control issues. So loss of control is a big one. Outsourcing means you're handing things over, and there are some vendors that give you full access to the data, and there are some vendors that give you read-only access to the data, and you can't make any changes. So you want to make sure you consider that and what your processes are, and how you're outsourcing it and what's the functionality behind that. The other one is quality variability. So not all outsourced billing vendor companies provide the same level of service. Just like any other vendor, it's it's all not the same. It's all, everybody's different. So you want to make sure, as Robin said, and Kurt said as well, to make sure that you're asking for references and you're learning how the vendors work with their customers. It's very important. And then dependency on the vendor performance. So you're relying heavily on them to be able to take care of issues that they encounter directly with your cash flow. So you want to select a vendor that has that experience and the tools to allow for these strong, for strong performance and higher collections. That's the reason why you're wanting to outsource. And then the potential for service issues. So providers, you have to trust that, your partner will act in your best interest and troubleshoot problems and keep the system updated efficiently. And you want to make sure that they're providing you with a contact so that you have direct contact to somebody that knows your business, knows your account, and is able to handle those things for you. Robin, do you agree with that?
I do. Certainly you want to make sure that many of these items that you've talked about, Jeanette, are already discussed and expectations are on the table, right? And any differences of opinion are resolved before you enter into that contract with the vendor. So, looking at these items that you've mentioned for the cons, you want to fully vet that vendor, as we've all talked about and have mentioned several times here today. But this is where it's really important, knowing that you have the ability to depend on your vendor, that they're going to be reliable, and that other laboratories and pathology services have also demonstrated their trust in that vendor. I think it is very important. But knowing that if you have any quality concerns, if you have any efficiency concerns, those need to be ironed out long before you enter into that agreement with that vendor. All right. I think unless we have anything else on that one, can you think of anything we haven't touched on for cons, Jeanette?
No, I think we can start getting into what's important.
I agree. I think we can move on. So looking at these next steps, just want to make certain that we do, convey very clearly today. Number one, that due diligence does not go away. I mentioned earlier that, engaging with a vendor does not remove your responsibility. There are key responsibilities that now come to you as managing the compliance and the oversight and the audit of that third-party vendor. Even though they've taken on maybe your staff or they have their own staff, depending on how you've arranged that within your contract, you're relying on their software, you're relying on them to submit your claims, but you still own responsibility for the compliance and the accuracy of that information. So now you need to worry about your in-house audit team, your in-house compliance team, whether it is an in-house legal team that has to coordinate all that, but you do have that responsibility. So we are looking though, right, in order to have expertise within that vendor. What do they have in place in order to look at our payer policies to make sure that we're billing according to their guidelines and that our coding and documentation is meeting the minimum standards as we're submitting that claim. We want to make certain that they have a full knowledge of what the criteria are for pathology billing. And any of us in this business know that having a coding staff and a billing staff that are fully knowledgeable of all of the different challenges in pathology and laboratory billing, that presents an issue. There's a reduced number of those experts within the industry. So we really want to make certain that you have someone at that vendor that is keeping not only their staff, but also keeping you abreast of what changes may take place in the payer's policies at end of year regulation or even mid-year regulation, right? As we're all reporting out to the Medicare max or within our state Medicaid, what is happening throughout the year that's updating those regulations or any policies that we have to be in compliance with. Which leads us into the next point is compliance. What is their workflow? What do they do internally to train their staff? And then what will be that communication out to your staff, just to make sure that everybody's staying on the same page. That's all very important. Maintaining a file or some way of tracking what have those changes been through federal and state regulations, because we always have lookbacks, we have audits, and what are they going to have on hand to help you address an issue that a payer may come back for 2 years later. And now you need to know, what was that regulation in place on the day that I submitted that claim? So all of those types of areas, you want to make sure that you're fully aware of what does the vendor have in place and how do they manage across their staff, and how do they keep their systems and their staff current, and then what do you have in place for auditing? Not only what are you auditing, but what does the vendor themselves audit internally, and how do they communicate back to you when they find a issue that needs to be raised to a compliance concern? All of that, I think, is of importance. So I'm going to stop there. That I've been talking a little bit, but Jeanette, any points so far that you would like to bring into that conversation?
No, I agree with that, because that is a concern, as an in-house biller right now looking to outsource, is that, I need to make sure that they're not gonna, we're not gonna have any risks or any compliance issues, if I move to somebody else basically managing it. So no, I completely agree with everything you said. Anatomic pathology is really complex. There's lots of compliance that has to goes on. There's lots of different rules that have to be in place. So we need to make sure that somebody's on top of that for sure.
Right. Right. And it becomes more complex depending upon the size of your practice and what's the variety of services that you'll be sending for billing through that vendor. If we're focused on pathology services, and we can ensure that they are fully aware of what those challenges are. Are you a practice that serves predominantly a physician setting, and you don't have so many challenges as we encounter with hospital billing and the split cases there? But making certain that the vendor understands our need for compliance with, do we split our technical charges off and invoice those back to a client, or do we have global billing? What do we technical bill for as we offer our services to support another provider? There's lots of challenges there that need to be faced when we're looking at pathology services. So there's been some discussion around having access to the system or having some control over how that information is being handled, and what is the data reporting from the vendor once you've begun submitting your claims through that service. I personally like the fact that I have view access, but I don't have to worry about editing my own claims. I'm not managing my claims. I'm not the person that's daily having to make sure that we're turning out claims timely and not holding based on the need for modifiers to be applied or the NCCI edits to be applied. But I do like having a view-only access and the ability to generate a report if I need it, so that I can conduct my own audits. Myself, I don't always work traditional 8 to 5 Monday through Friday hours. So if I'm looking at an issue and it's on a Friday evening, I may want to access the system and pull some reports just to see if something that I have seen is carrying further out to a trend. So having a discussion with the vendor about what your access will be, again, level setting. Do you really want live access where you have some responsibility for touching those claims or your staff? And then what's that liability for the share of that touch between the vendor staff and your staff. So I think all of those add to the complexity of what you're looking at for your contract negotiations. I've already touched on the fact that I like to do my own audits, and then we also have an internal staff that we work with. We share a lot of our responsibilities through the compliance department and with legal, but we also work with our billing cohorts in the company, as well as those persons in our vendor side who are responsible for the claim submission, managing our denials, managing our appeals, and such as that. So having those open lines of communication are really, really key, and being able to rely on them to identify trends for me, and knowing that they can help share that through reports on a timely basis with our leadership, and can help to explain any trends or analytics that we need to be aware of. So all of that, I think, really plays in key to what you have to rely on the vendor for in order to be able to provide information back to you in a timely and meaningful format that everybody can share. So, all of that comes down to being able to optimize, looking at your practices within a, under the whole umbrella, making sure that profitability analytics are fed back to you real time. If you are running up against a challenge on a particular service, a particular CPT code, if you have a vertical that you have specialized for a particular test, who is managing that and keeping an eye on the profitability? All of those things are really key, and come down to managing the line of communication. I know there's been some conversation around, who can you call? What is your contact person? You need somebody to contact at all levels. Is it a billing question, or is it that you need to have a strategy discussion, and how do you optimize a particular service? So knowing who your contacts are is also great, and outlining all of that within contracts, so that over the years you have a document you can refer back to and align on where you're sitting. From the practice side, are you asking for more support than what was included at the beginning of your contract, and over the years has that kind of morphed? Or is it that you are needing more support from the vendor, and maybe you've outlined some of that within your contract, but it is not being met from your perspective? And how do you sit down and review that with your vendor, and make sure that everyone is in alignment on what the support needs are, what the staff needs are, and how is the vendor managing your claims, your reimbursement, and your collections based on your expectation of their KPIs? How do they perform based on your expectation? And do your KPI expectations align with theirs? That's always key in knowing whether you're looking at the benchmarks. How are they reporting out to you on the trends? And is everybody sharing that information openly? And how do you handle when there's a disagreement about how a particular service line or payer policy is being managed? You have to know how you're going to handle those differences, and how it, at the end of the day, impacts your bottom line. Is there something that you need to work with the vendor on customization in order to meet your standards? And how is that addressed in your contract? So that's a really long conversation, lots of information, and I'm going to just stop there for a moment, Jeanette, and get your opinion on a lot of what I just said.
Yeah, I completely agree with everything you said. And, just a couple things as an in-house vendor looking to outsource, there are some things that are key for me. And that is, again, with the service and communication is, making sure that they're responding to any requests that we have timely. You know, I have situations all the time where I have a client that says, oh, you know what, can you change this and can you bill us for this? Bill us for the biopsy and bill, you know, the stain to the payer or the patient, you know, just weird things like that. And, you know, as long as it's compliant, obviously, but you've got to put that in place immediately. They're not going to wait 30 days for you to handle that. So, you know, you've got to have a way that there is a way to escalate issues and know how your vendor handles those urgent issues that have to be done today, you know, things like that.
Yeah, and I think it's a matter of meeting the definition of urgent, right? Because from the vendor's perspective and from my perspective, while I'm having conversation with the client, we may both have a difference of opinion of urgent. So I think it's important to understand where is the level of customer support and customer service, and how do we share that responsibility for caring for our clients? That's always a very good point.
Yeah, I completely agree with that. And I know we're getting close on time here, so let's kind of quickly
move on.
Move through the last ones in here are just like payer contracting and credentialing, because I know there are some vendors out there that will do your contracting and do your credentialing. So check into that. Also MIPS reporting. You know, do they just pull a file, or do they actually either have a registry that they work with? Or are they able to code and do that for you, or is that something that your practice is going to have to do? So if you have to report on MIPS, that's important to ask those questions. And then we've touched on contract terms several different times. You know, most of them are based on a percentage of collections, but there are other options out there. You need to make sure that contract talks about that. What are your expectations? What are the KPIs that they have to meet? And then, you know, does that percentage go down if they don't meet those, or, you know, whatever. Also subcontractors and outside vendors, how are those handled? And then what's your term clause specifically without a clause, in case you need an out. So, those are the big things to consider. So let's move on to implementation. So the next few slides are we're just going to go through really quick. It's just talking about things to consider at different aspects. So your first thing when you choose a vendor is your implementation. I want to say that I disagree a little bit with what Kurt mentioned and Carrie mentioned about the implementation when you outsource is 45 to 60 days. If it's a clinical lab, sure, you know, it's pretty straightforward. But with pathology involved, there are so many different rules, so many different payer rules. There's split billing if you have hospital business. You know, there's all kinds of things that you have to consider. I know there's labs out there that have certain rules with certain clients for different things. There may be some proprietary testing that you do that we have, for example, a gender reveal test that doesn't have a CPT. So it's either client or patient billed. You know, there's all these different rules that you have to make sure are implemented successfully. And so those all have to be considered. And then your processes, you know, what is your workflow now compared to what their workflow is? Is it exception based? You know, things like that. And how do you make sure that the process is going to manage or mirror what you did, but also be more efficient, obviously. Robin, I know you had something you wanted to talk again about some of the split billing and the delegation too.
Right, and I think some of that we've touched on enough, other than, you know, just reinforcing that the delegation of responsibilities to the vendor. You need to know that you trust that they have all the correct steps in place. I know, Jenna, you mentioned around how do they have the rules in place and how can they handle your special exceptions, and especially when you're starting that first implementation phase. And can you complete that within 60 days, or is it a 3-month implementation? I know for us, it's a matter of what does your vendor already have in place? If they're handling pathology billing, then many times they already have some of those rules in place and can handle. We work very closely with our vendor in order to manage what our billing rules are and any special exceptions. But again, it's an audit touch point. Every year we have to re-audit all of those exceptions to make sure that they're correct. So it's just always enforcing the fact that you do have due diligence and responsibility, even though you hand off those services to a vendor.
Right. And the last thing on here is staffing up. So a lot of the vendors will rebadge your employees, so that your employees then become their staff. That's fine. But what do you do if an employee doesn't want to rebadge? How are they going to handle that? And do they already have staff in place? But you want whoever's working on your book of business, I would think you would want them to be only working on your book of business. So they're familiar with everything that you do. The next one is daily processing. So just, again, we talked about changes and updates. How quickly does that happen? What's the time frame around that, the turnaround time? And, do you open a ticket? Do you send an email? Do you make a phone call? How do these get put in place? Because you do want some kind of tracking system to know. I'm not in favor of a ticket system. I know how don't say anything, but I know how my IT tickets don't get done sometimes for months. So it's important that, you have something that you can get things done immediately if needed. And then your interfaces, you have interfaces not only from your LIS, getting the billing, the charges and demographics into the billing system, but you also have interfaces from hospitals where you're getting the same information for billing, things like that. So who handles that? Some vendors will work directly with your hospitals and do that. Some others want you to handle that, especially if you're going through an interface engine versus getting the file directly from the hospital. It just depends how you're set up. So those are all things to consider. And then performance. So the success, again, of outsourcing is that you're relying heavily on their performance and improving efficiencies and things like that for you. Robin, I know you had something about your vendor IT, working with IT.
You do need to know if there's a cost for working with their IT as opposed to having your own in-house IT that will help with interfacing and such as that. So again, that's part of your decreasing what your employee and benefit costs are by engaging with a vendor, but you do have other costs. So it may be that you have an hourly rate that you have to pay for use of their IT staff. Make sure that that's outlined within the contract.
Right. And then the last thing is, refunds and recoupments, there should be a threshold that they have, and how are those handled? And do they come back through you if they're above that threshold? And then finally, documentation. If you've got an audit you're doing, you want to make sure you have access to all that documentation, especially if you have to send it to an outside agency such as Medicare or anybody else. So you want to make sure that's readily available.
You do. One of the benefits, I'm sorry, now I'm just going to jump in there really quick, is one of the benefits of a vendor, though, right, is they can pull documentation. They can reach out to clients if that's what you choose to obtain any missing documentation. They can correlate that, but you definitely want to have that last touch of review of that packet before it goes out to your payer.
A good point. As far as relationships, there are a lot of subcontractors that many of us work with. You may already outsource things like the coders or data entry. You may outsource those to another company that does that for you now, so you don't have to necessarily staff for that now. So will that vendor work with those subcontractors that you have? And then again, I know the other thing is outside vendors, other vendors such as clearinghouses and things like that. But most of the vendors already have relationships with clearinghouses and those things. But what about statement vendors? Do they allow you to choose your statement vendor, or do you have a statement vendor that they use that you have to go through? I say that with also coverage discovery or client billing invoices, things like that. And then collection agencies as well. If you use a collection agency, do you get to choose who that is? And so those are all things to consider and also make sure that are part of your contract.
Agreed. And I think you have to know what the, if your vendor is engaging with those subcontracts, then who is measuring those KPIs and making certain that the subcontract meets your expectations of KPI too? Because now does that just twofold, right? Increase the amount of auditing and checks that you need to do, or is that the vendor's responsibility? And then how do they report out to you on what are the KPIs coming in from that subcontractor, regardless of what the service is that they're providing for you?
Yeah, I agree. Lastly is monitoring. And I know, Robin, this is a big part of what your job is, making sure everything's compliant and there's no risk and things like that. So do you want to go ahead and touch on monitoring?
Sure. No, sure. I can take some of that. And again, it could be a very long conversation, but we are approaching the top of the hour, so I'll reduce this down. But it is that you have to have that expertise in-house to do the auditing. You need to make certain that you are on a timely schedule, so that you have certain audits you conduct every month. You have other audits that you conduct quarterly or annually. But how are you working with your vendor to identify where you have risk? And then how do you audit to mitigate that and reduce that? We are frequently asking for, the test orders with utilization that have medical necessity concerns. Are we seeing a new test that we're beginning to see denials on for medical necessity? Or is there a change in payer that they're asking for additional documentation? And are we meeting the requirements of those documentation requests? So managing all of that, auditing, and then ensuring that your expectation of the KPIs is being met. What is your AR days? And who's counting that AR day, beginning from either, is it date of accession, or is it the date that you bill charges for the first time? Is it the date that information is received by the vendor in the billing system? There can be lots of different translations of how you're tracking your AR. Make sure that everybody is in alignment, and that then you're managing your KPIs and auditing your vendor to make sure that they are staying in line with what your expectations are. All of this needs to be covered in your contract as to what is their responsibility for reporting out to you real time, your month-end closing process, and how are you made aware of what your revenue is, what are your collections, what is outstanding, giving you a full view of your financials so that you're not caught off guard at that last day of the month. And again, as I mentioned earlier, how do they translate that information so that it's shared with your leadership? Right within pathology, we have to have an understanding from a clinical perspective, but also our leadership may come to that conversation without a clinical background, maybe financial or operations. So those communications need to be translated and shared so that everyone is understanding how our claims are being processed. What is our percent of clean claims? What is our percent of denials? How many of our denials are being reworked and resubmitted as a corrected claim? How many of our denials are being appealed? How many of those appeals are successful? And how many of our denials move straight to write-off, or that they sit pending resolution until it's time to write off? All of those are KPIs that are very important to be tracked.
Yeah, I completely agree. So now it's time to make the decision. What are you going to do? You've got to know what your principles are and your considerations and everything involved in your practice in order to make that decision. Do you want to use a service? Do you want to outsource? Do you want to do it yourself? Maybe you want to do a little of both. There's a lot of hybrid models that you could do out there if the vendor's willing to work with you on that. So you need to be able to do that and identify the top vendors that are in your area. As everybody has said, speak with references, determine your timeline. What is your target billing mix? You know, your percentage, your client bill, your payer bill, let them know all of that. You're in and out of network. Anything that's non-negotiable features, functions, or services that you need to have in place, and define the metrics that you require to make informed decisions. And remember, this is the financial data that goes to your accounting and finance departments. What do they need? And are they going to get the information they need to be able to report to the upper management? So those are all things that are really important. And it's never too early to establish key metrics. It's a good idea for you to monitor and measure from the very beginning exactly how you're doing, and them as well. And that's all we have, but I think we have some questions out there.
We do. Robin and Jeanette, thank you. That was a ton of information. So hopefully our attendees have found, you know, a significant amount of value in that today. We've had 2 questions come in through the Q&A. Carrie's going to read both of those off. She'll start with the first one, and then if we have time, we'll get to the next one.
If group engages with outside vendor, who should do CPT coding assignments? The pathologist or vendor certified coders? Would coders need permission to change the CPT codes? Most billing companies are paid on percentage of collections.
So as an in-house, I will tell you, we have coders on staff. They do not code in the billing system. They code in our LIS. So those CPT codes and ICD-10 codes get changed, if you will, if needed, before it even comes into our billing system. I believe that we will probably maintain that if we were to ever outsource. Robin, what's your practice?
We do have staff that review and audit what the pathologist may have selected as the CPT code, but we would always open that for conversation. If there is a necessity to change either a diagnosis code that is selected by a pathologist, or if it's a CPT code that is driven through our system based on the service being provided, we would want that communication through query, so that if it's something that needs to be corrected, we're all aware and there's documentation of that communication. But at this time, we handle that in-house, and our vendor does, however, provide us feedback if they identify a CPT code that seems to vary from what they see of other providers, or if there's a question just of what they see coming back on denials, they'll raise a CPT code to us for question, but there is not a change without having that conversation and documenting that conversation.
All right, thank you both. Let's squeeze in our last question here, Carrie.
Hospital-based path groups that are totally independent of a hospital and receives interfaces from the hospital, should they assign ICD-10 codes per specimen case, or is it okay to accept the ICD-10 codes the hospital sends on the interface?
Jeanette, what do you do in-house there first?
So yeah, this will have to be looked at if and when we would outsource, because we actually hold our hospital cases in billing until we get the reports from the hospital, and then we code from those reports for pathology. We do not accept the ICD-10 codes from the hospital because they're usually coding it based on the admission, signs and symptoms, but not the biopsy or the pathology portion. For clinical testing, obviously, it would be whatever the hospital sends.
Right. And, you know, I think just referencing back to what the guidelines are for coding is the diagnosis codes is going to depend on what the service is that you're discussing here. But for pathology, if I'm talking about a professional interpretation, then I would code for that professional interpretation. But sometimes the interpretation by the pathologist needs additional diagnosis codes in order to support a billable service. So is it the clinical indications that come through the interface from the hospital? I think it's a sort of a shared responsibility, again, looking at what is your overall documentation for the case. And then do you add to, or do you bill solely based on the pathologist documentation? But I would suggest there you follow what the industry guidelines are for diagnosis coding, and make sure, again, that you're documenting any revisions that you may have or any discussions between the coding staff and your professional staff.
Great. Well, that
All right.
is,
Well, again, thanks. Oh, sorry, Jeanette.
no, go ahead. Go ahead, Kurt.
I was going to say, we are at the top of the hour and out of time. So I was going to say thanks to everybody. Did you have some final comments you want to make?
We did. We wanted to move to the last slide and just invite everyone to please do plan to join us for our annual meeting in September, which will be held in Meadowlands. And so we're moving this year from the West Coast to the East Coast. We'll be in New Jersey. And we also would like to just invite all of the attendees today to look to the website and consider subscription to the Pathology Services Coding Handbook. So we do greatly appreciate your attendance today and hope to see you in September.